start. It's 4:30 a.m. I'm in Helsinki, heading to the airport. Next stop Copenhagen, then I'll be heading to Frankfurt for a layover and then into Milan tonight.
Northern Italy, specifically the Lombardy region, saw the first European COVID-19 cases starting on February the 21st, with the first deaths occurring on February the 22nd, and by the beginning of March, the virus has spread to every region in Italy. Today, 35,000 have died, but the country is adapting both with policy, I'm in Milan and you have to wear a mask outside, and the way that they diagnose, manage and treat COVID-19 patients. This is Niguarda Hospital, a major general public hospital in Milan that had to adapt rapidly to the huge influx of COVID-19 patients. Inside is Dr. Fumagalli, whom I'm about to go and chat to. He's an intensivist doctor that was at the center of this hospital's ICU response to the pandemic. Dr. Fumagalli, you were at the center of Niguarda Hospital's rapid response to COVID-19. What were the biggest challenges that you faced that you weren't aware of?
The number of patients arriving to the hospital was continuously increasing. It was a nightmare. Every day we need a room, we need beds for ICU for patients with respiratory failure. And then we started in recruiting all the ICUs inside the hospitals in order to admit COVID-19 patients. So at the beginning we had 35 ICU beds, and then we went up to almost 100 ICU beds, 76 dedicated to COVID-19 patients, all intubated patients, and that was really a tough job.
You're exposing yourself every day to multiple opportunities where you can catch the virus, and then you've got to go home to your family. How did you personally deal with that?
I had the chance, watching to the eyes of colleagues, nurses, really feeling that they were scared about that. My routine work was not just standing for hours and hours in front to patient. It happened several times, but it was not a continuous shift on patients. So I had the chance to protect myself. Some of my colleagues decided not to come at home for a long period of time, just because they did not want to bring at home something. And so they dedicated themselves, and they deserve all the thanks and admiration for what they did.
Do you think psychologically the medical staff will be affected, almost like sort of a post-traumatic stress disorder type situation? Do you think that is an issue that will have to be addressed and managed as we go forward?
Yeah, I absolutely agree with that. Actually, we had a person dedicated to take care of the staff. A psychologist dedicated to take care of the staff, because there is another issue quite important, that no chances to deal directly person to person with relatives, and we did not have any chance to let's say to share emotions with relatives. This is an important part of our job. It's a very important part, especially if you think that you are accompanying a patient to die, and you know how important was that person for relatives, and they are far away from the patient, and the patient is gonna die. And this was a very heavy situation for us, for all of us. we tried to allow all the relatives to speak with us, at least just giving the photos of the patients. Maybe when the patient was just improving. Some of them we just gave some walkie-talkie and we allowed the relatives to speak with the patient with the walkie-talkie, just seeing the patient through the windows.
When you look back, are there any particular moments with patients that you'll remember?
Yes, there was a colleague who got the infection, and unfortunately he died. After many days, we tried everything on him, and this was something that was very important for the old staff, because we had been really very impressed. We knew him. He was not working here, but many of us knew him, and he improved for a while, then he got septic, and then he improved again, and then he's got worse and worse, and eventually he died.
I think it's still uncertain. We're certainly not out of the woods, and I think your job is yet to be complete on this one. So, thanks very much. I really appreciate it.
Thank you.